Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuy.com. This is 25 practice NCLEX questions. Without the way, let's get started.
Which of the following outcome criteria would a nurse develop for a child with cystic fibrosis who has ineffective airway clearance related to increased pulmonary secretions and inability to expectorate? 1. Respiratory rate and rhythm within expected range. 2. Absence of chills and fever. 3. Ability to engage in age-related activities. 4. Ability to tolerate usual diet without vomiting. The correct answer is 1. After treatment. The client outcome would be that respiratory status would be within normal limits, as evidenced by a respiratory rate and rhythm within expected range. Absence of chills and fever, although related to an underlying problem causing the respiratory problem, do not specifically relate to the respiratory problem of ineffective airway clearance. The child's ability to engage in age-related activities may provide some evidence of improved respiratory status. However, this outcome criterion is more directly related to activity intolerance. Although the child's ability to tolerate his or her usual diet may indirectly relate to respiratory function, this outcome is more specifically related to an imbalanced nutrition that may or may not be related to the child's respiratory status. A school-age child with cystic fibrosis asks the nurse what sports she can become involved in as she becomes older. Which of the following activities would be appropriate for the nurse to suggest? 1. Swimming. 2. Track. 3. Baseball. 4. Javelin throwing. The correct answer is 1. Swimming would be the most appropriate suggestion because it coordinates breathing and movement of all muscle groups and can be done on an individual basis or as a team sport. Because track events, baseball, and javelin throwing usually are performed outdoors, the child would be breathing in large amounts of dust and dirt, which would be irritating to her mucous membranes and pulmonary system. The strenuous activity and increased energy expenditure associated with track events, in conjunction with the dust and possible heat, would play a role in placing the child at risk for an upper respiratory tract infection and compromising her respiratory function. When explaining to parents how to reduce the risk of sudden infant death syndrome, the nurse should teach about which of the following measures. Select all that apply. 1. Maintain a smoke-free environment. 2. Use a wedge for sideline positions. 3. Breastfeed the baby. 4. Place the baby on his back to sleep. 5. Use bumper pads over the bed rails. 6. Have the baby sleep in the parent's bed. The correct answers are 1, 3, and 4. Exposure to environmental tobacco increases the risk for SIDS. Sleeping on the back and breastfeeding both decrease the risk of SIDS. The sideline position is not recommended for sleep. It is recommended that babies be dressed in sleepers and that cribs are free of blankets, pillows, bumper pads, and stuffed animals. Co-bedding with parents is not recommended as parents may roll on the child.
An 18-month-old child has oral mucositis secondary to chemotherapy. Which task should the nurse delegate to the assistive personnel? 1. Reporting evidence of severe mucosal ulceration. 2. Assisting the child in swishing and spitting mouthwash. 3. Assessing the child's ability and willingness to drink through a straw. 4. Feeding the child a bland, moist, soft diet. The correct answer is 4. Feeding the child a bland, moist, soft diet. Helping the child to eat is within the scope of responsibilities for an AP. Assessing ability and willingness to drink and checking for extent of mucosal ulceration are the responsibilities of a nurse. An 18-month-old child is not able to swish and spit, which could result in swallowing the mouthwash. Mouthwash is not intended for swallowing because it can contain alcohol and other ingredients not safe for ingestion.
Parents bring their child to the emergency department because the child has stopped breathing. A nurse obtains a brief history of events occurring before and after the parents found the infant not breathing. Which of the following questions should the nurse ask the parents first? 1. Was the infant sleeping while wrapped in a blanket? 2. Was the infant lying on his stomach? 3. What did the infant look like when you found him? 4. When had you last checked on the infant? The correct answer is 3. because this is an especially disturbing and upsetting time for the parents. They must be approached in a sensitive manner. Asking what the infant looked like when found allows the parents to verbalize what they saw and felt, thereby helping to minimize their feelings of guilt without implying any blame, neglect, wrongdoing, or abuse. Asking if the child was wrapped in a blanket or lying on his stomach, or when the parents last checked on the infant, implies that the parents did something wrong or failed in their care of the infant, thus blaming them for the event.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with chronic kidney disease is prescribed apoetin. Which statement best describes the scientific rationale for administering this medication? 1. This medication stimulates red blood cell production. 2. This medication stimulates white blood cell production. 3. This medication is used to treat thrombocytopenia. 4. This medication increases the production of urine. The correct answer is 1. This medication stimulates red blood cell production. Apoetin, a biologic response modifier, is a glycoprotein produced by the kidney that stimulates red blood cell production in response to hypoxia. It is prescribed to treat the anemia that occurs in clients diagnosed with CKD. Filgrastim is the biological response modifier that stimulates WBCs and is not used in the treatment of CKD. Oprelvacin is the biological response modifier that stimulates megakaryocyte and thrombocyte production, which stimulates platelet production to prevent thrombocytopenia in clients receiving chemotherapy. There is no medication that increases the production of urine. Diuretics increase the excretion of urine, but do not affect the production of urine. The nurse is assessing a client experiencing motor loss as a result of a left-sided cerebrovascular accident. Which clinical manifestations would the nurse document? 1. Hemiparesis of the client's left arm and apraxia. 2. Paralysis of the right side of the body and ataxia. 3. Homonymous hemianopsia and diplopia. 4. Impulsive behavior and hostility toward family. The correct answer is 2. Paralysis of the right side of the body and ataxia. The most common motor dysfunction of a CVA is paralysis of one side of the body, hemiplegia. In this case, with a left-sided CVA, the paralysis would affect the right side. Ataxia is an impaired ability to coordinate movement. A 40-year-old client is admitted to the hospital with a diagnosis of acute cholecystitis. The nurse should contact the physician to question which of the following prescriptions? 1. IV fluid therapy of normal saline solution to be infused at 100 ml per hour until further prescriptions. 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. 3. Nothing by mouth until further prescriptions. 4. Insert a nasogastric tube and connect to low intermittent suction. The correct answer is 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. A nurse should question the prescription for morphine sulfate because it is believed to cause biliary spasm. Thus, the preferred opioid analgesic to treat cholecystitis is meperidine. Elderly clients should not be given meperidine because of the risk of acute confusion and seizures in this population. An alternative pain medication will be necessary. IV fluid therapy is used to maintain fluid and electrolyte balance that may result from NPO status and gastric suctioning. NPO status and gastric decompression prevent further gallbladder stimulation.
A client who has a history of a mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. Clients who are at risk for developing infective endocarditis due to cardiac conditions, such as mitral valve prolapse, must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition. Which assessment findings should lead the nurse to suspect that a toddler is experiencing respiratory distress? Select all that apply. 1. Coughing. 2. Respiratory rate of 35 breaths per minute. 3. Heart rate of 95 beats per minute. 4. Restlessness. 5. Malaise. 6. Diaphoresis. The correct answers are 1, 2, 4, 6. Coughing, especially at night and in the absence of an infection, is a common symptom of asthma. Early signs of respiratory distress include restlessness, tachypnea, tachycardia, and diaphoresis. Other signs also include hypertension, nasal flaring, grunting, wheezing, and intercostal retractions. A heart rate of 95 beats per minute is normal for a toddler. Malaise typically does not indicate respiratory distress. A client has been admitted to the coronary care unit. The nurse observes third-degree heart block at a rate of 35 beats per minute on the client's cardiac monitor. The client has a blood pressure of 90/60. The nurse should take which of the following actions first? 1. Prepare for transcutaneous pacing. 2. Prepare to defibrillate the client at 200 joules. 3. Administer an IV lidocaine infusion. 4. Schedule the operating room for insertion of a permanent pacemaker. The correct answer is 1. Transcutaneous pacemaker therapy provides an adequate heart rate to a client in an emergency situation. Defibrillation and a lidocaine infusion are not indicated for the treatment of third-degree heart block. Transcutaneous pacing is used temporarily until a transvenous or permanent pacemaker can be inserted.
The nurse is evaluating a client with hyperthyroidism who is taking propylthuracil 100 milligrams per day in 3 divided doses for maintenance therapy. Which of the following statements from the client indicates the desired outcome of the drug? 1. I have excess energy throughout the day. 2. I am able to sleep and rest at night. 3. I have lost weight since taking this medication. 4. I do perspire throughout the entire day. The correct answer is 2. I am able to sleep and rest at night. PTU is a prototype of thioamide antithyroid drugs. It inhibits production of thyroid hormones and peripheral conversion of T4 to the more active T3. A client taking this antithyroid drug should be able to sleep and rest well at night, since the level of thyroid hormones is reduced in the blood. Excess energy throughout the day, loss of weight, and perspiring through the day are symptoms of hyperthyroidism, indicating the drug has not produced its outcome. The nurse has completed an assessment of a client with a decreased cardiac output. Which findings should receive the highest priority? 1. BP 110/62, atrial fibrillation with heart rate 82, bibasilar crackles. 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. 3. Oxygen saturation 92% on 2 liters via nasal cannula, respirations 20, 1 plus edema of lower extremities. 4. Weight gain of 1 kilogram in 3 days, BP 130/80, mild dyspnea with exercise. The correct answer is 2. Confusion, urine output 15 milliliter over the last 2 hours, orthopnea. A low urine output and confusion are signs of decreased tissue perfusion. Orthopnea is a sign of left-sided heart failure. Crackles, edema, and weight gain should be monitored closely, but the levels are not as high a priority. With atrial fibrillation, there is a loss of atrial kick, but the blood pressure and heart rate are stable. The nurse identified late fetal heart decelerations, and decreased variability in the fetal heart rate of a woman in active labor, and notified the healthcare provider on call, who advised the nurse that the pattern is acceptable. What would be the priority action at this time? 1. Advise the patient that a different HCP will be called because the first HCP's response was not adequate. 2. Discuss the concerns with another labor and delivery nurse. 3. Document the conversation with the HCP accurately, including the HCP's interpretation and recommendation, and continue close observation of the fetal heart rate. 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The correct answer is 4. Go up the chain of command and communicate the assessment of the fetal heart rate findings clearly to the next appropriate person per unit protocol. The nurse must follow through on the findings of a non-reassuring fetal heart rate. When patient safety is concerned, the nurse is obligated to pursue an appropriate response. Documenting the conversation with the HCP and discussing it with a colleague are appropriate, but something must be done to address the immediate safety concern and possible need for intervention at this time. The nurse must persist until the safety concern has been addressed appropriately.
A nurse is conducting a psychoeducational group for family members of clients hospitalized with depression. Which family member's statement indicates a need for additional teaching? 1. My husband will slowly feel better as his medicine takes effect over the next 2 to 4 weeks. 2. My wife will need to take her antidepressant medicine and go to group to stay well. 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. 4. My mother might need help with grocery shopping, cooking, and cleaning for a while. The correct answer is 3. My son will only need to attend outpatient appointments when he starts to feel depressed again. Rationale. Additional teaching is needed for the family member who states her son will only need to attend outpatient appointments when he starts to feel depressed again. Compliance with medication and outpatient follow-up are key in preventing relapse and rehospitalization. The statements expressing expectations of feeling better as medication takes effect, needing medicine and group therapy to stay well, and needing help with grocery shopping, cooking, and cleaning for a while indicate the family's understanding of depression, medication, and follow-up care.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Indomethacin may be given to close which congenital heart defect in newborns? Blank. The correct answer is patent ductus arteriosus. Prostaglandins allow the duct to remain open. Thus, a prostaglandin inhibitor, such as indomethacin or ibuprofen, can help close the duct. The nurse in the long-term care facility is caring for a client with an indwelling catheter. Which preparation should the nurse order for the client? 1. Cranberry juice with breakfast daily. 2. Nitrofurantoin, 100 mg every 12 hours for 7 days. 3. Vitamin C every night at bedtime. 4. Golden Seal 2 milliliters in water, 2 to 3 times daily. The correct answer is 1. Cranberry juice with breakfast daily. Cranberry juice is acidic and will change the pH of the urine, making it harder for bacteria to survive in the environment. It can be used prophylactically to prevent UTIs. It does not treat an infection. The nurse can arrange with the dietitian to include this in the client's dietary plan. Nitrofurantoin, a sulfa drug, is a prescription medication that is used to treat chronic UTIs, but the nurse could not order this medication. In a long-term care facility, over-the-counter vitamin C would require an HCP order. Golden Seal is an herb used for UTIs, but in a long-term care facility, it would require an HCP order. The male client is admitted to the medical floor with a diagnosis of pyelonephritis. Which intervention should the nurse implement first? 1. Initiate IV access with a 20-gauge catheter. 2. Administer the IV antibiotic within 2 hours of admission. 3. Obtain a urine specimen for culture and sensitivity. 4. Notify the dietary department to order the client a regular diet. The correct answer is 3. Obtain a urine specimen for culture and sensitivity. The nurse should obtain a clean voided midstream specimen for culture and sensitivity before initiating the antibiotics. This is the first intervention to implement. The IV is important to initiate therapy, but the nurse should obtain a clean voided midstream urine for culture and sensitivity before initiating the treatment. If the culture is not obtained prior to initiating the antibiotic, the results of the laboratory test will be skewed. A diet order is not a priority over getting the treatment started. UTIs in males are difficult to treat and can be life-threatening. The nurse is caring for a client who had an open cholecystectomy 24 hours ago. The client's vital signs have been stable over the last 24 hours, with most recent temperature 37 degrees Celsius, blood pressure 118/76, respiratory rate 16 breaths per minute, and heart rate 78 beats per minute, but are now changing. Which of the following indicate that the nurse should contact the physician? 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. 2. Temperature 38.2 degrees Celsius, blood pressure 118/68, heart rate 84 beats per minute, respiratory rate 20 breaths per minute. 3. Temperature 37.5 degrees Celsius, blood pressure 126/80, heart rate 58 beats per minute, respiratory rate 16 breaths per minute. 4. Temperature 36.4 degrees Celsius, blood pressure 98/64, heart rate 98 beats per minute, respiratory rate 18 breaths per minute. The correct answer is 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. This client is exhibiting 3 of 4 signs of systemic inflammatory response syndrome: temperature greater than 38 degrees Celsius or less than 36 degrees Celsius, heart rate greater than 90 beats per minute, respiratory rate greater than 20 breaths per minute. The fourth indicator is an abnormal white blood cell count, greater than 12,000, less than 4,000, or greater than 10% bands. At least 2 of these variables are required to define systemic inflammatory response syndrome. After a cholecystectomy, the client is to follow a low-fat diet. Which of the following foods would be most appropriate to include in a low-fat diet? 1. Cheese omelet. 2. Peanut butter. 3. Ham salad sandwich. 4. Roast beef. The correct answer is 4. Roast beef. Lean meats, such as beef, lamb, veal, and well-trimmed lean ham and pork, are low in fat. Rice, pasta, and vegetables are low in fat when not served with butter, cream, or sauces. Fruits are low in fat. The amount of fat allowed in a client's diet after a cholecystectomy will depend on the client's ability to tolerate fat. Typically, the client does not require a special diet, but is encouraged to avoid excessive fat intake. A cheese omelet and peanut butter have high fat content. Ham salad is high in fat from the fat in salad dressing. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client with cholecystitis continues to have severe right upper quadrant pain. The nurse obtains the following vital signs: temperature 38.4 degrees Celsius, pulse 114, respirations 22, blood pressure 142/90. Using the S-bar technique for communication, the nurse recommends to the primary care provider for the client to receive 1. Hydromorphone IV, 2. Dultayazem PO, 3. Meperidine IM, 4. Promethazine IM. The correct answer is 1. Hydromorphone IV. Hydromorphone should be considered for pain management. It should be administered intravenously for rapid action to address the severe pain the client is experiencing. Intramuscular injections are painful and slower acting. Since meparidine's toxic metabolite can cause seizures, it is no longer the treatment choice for pain. Diltiazem, a calcium channel blocker, is not indicated. Elevation of heart rate and blood pressure is likely due to pain and fever. Promethazine is used to treat nausea. The nurse prepares to administer promethazine 35 mg IM as prescribed PRN for a client with cholecystitis who has nausea. The ampule label reads that the medication is available in 25 mg per ml. How many milliliters should the nurse administer? To solve this problem, you set up the formula as 35 mg over X equals to 25 mg over 1 milliliter. You cross-multiply 35 times 1 and X times 25. You get 25X equals to 35. You divide 25 on both sides, and you get X equals to 1.4 milliliters. A client undergoes a laparoscopic cholecystectomy. Which of the following dietary instructions should the nurse give the client immediately after surgery? 1. You cannot eat or drink anything for 24 hours. 2. You may resume your normal diet the day after your surgery. 3. Drink liquids today and eat lightly for a few days. 4. You can progress from a liquid to a bland diet as tolerated. The correct answer is 3. Drink liquids today and eat lightly for a few days. Immediately after surgery, the client will drink liquids. A light diet can be resumed the day after surgery. There is no need for the client to remain on nothing by mouth status after surgery because peristaltic bowel activity should not be affected. The client will probably not be able to tolerate a full meal comfortably the day after surgery. There is no need for the client to stay on a bland diet after a laparoscopic cholecystectomy. The client should, however, avoid excessive fats. Which of the following discharge instructions would be appropriate for a client who has had a laparoscopic cholecystectomy and has sutures covered by steri-strips? 1. Avoid showering for 1 week after surgery. 2. Return to work within 1 week. 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. 4. Use acetaminophen to control any fever. The correct answer is 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. After a laparoscopic cholecystectomy, when there are sutures covered by a dressing or steri-strips, the client should not remove dressings from the puncture sites, but should wait until visiting the surgeon. The client may shower 48 hours after surgery. A client can return to work within 1 week, but only if approved by the surgeon and no strenuous activity is involved. The client should report any fever, which could be an indication of a complication. After a client who has had a laparoscopic cholecystectomy receives discharge instructions, which of the following client statements would indicate that the teaching has been successful? Select all that apply. 1. I can resume my normal diet when I want. 2. I need to avoid driving for about 4 weeks. 3. I may experience some pain in my right shoulder. 4. I should spend 2 to 3 days in bed before resuming activity. 5. I can take a shower 2 days later. The correct answers are 1. I can resume my normal diet when I want. 3. I may experience some pain in my right shoulder. And 5. I can take a shower 2 days later. Following a laparoscopic cholecystectomy, the client can resume a normal diet as tolerated. The client may experience right shoulder pain from the gas that was used to inflate the abdomen during surgery. The puncture site should be cleansed daily with mild soap and water. If a Band-Aid was applied after surgery, it can be patted dry or removed and replaced. Driving can usually be resumed in 3 to 4 days following surgery, and there is no need for the client to maintain bed rest in the days following surgery. Light exercise such as walking can be resumed immediately. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanursiguide.com.